The EVLT procedure is one of the minimally invasive treatments for varicose veins that has essentially revolutionized varicose vein treatments. What EndoVenous or endovascular technology essentially refers to is a non-surgical approach to treating a condition by performing the procedure inside the vein under the use of X-ray or ultrasound guidance, where a catheter or drug can be delivered inside the lumen of the vein externally just through an IV access or a needle access site and take care of the problem by closing or killing the varicose veins without having to physically remove them surgically. Before EndoVenous laser therapy came out, the majority of procedures that I performed for varicose veins were actually performed surgically in the hospital. Now, almost 100% of our varicose vein treatments are actually performed in our office. Before the EndoVenous laser therapy came out, or the EVLT therapy came out, almost all varicose vein surgeries performed in the United States required open surgical operations to repair the varicose vein problem. The reason that the EndoVenous laser therapy revolutionized the field is it suddenly shifted where instead of people requiring operations in hospitals or operations in surgery centers under general anesthesia to get their varicose veins taken care of, suddenly everyone was able to get their varicose veins taken care of with non-surgical methods done through the doctor's office. So we went from needing open operations with incisions on almost all patients to suddenly only needing small IV access sites to be able to treat the same exact condition. The way that revolution came about was initially from the growth and advances in ultrasound technology, which allowed us to determine with an ultrasound map exactly what was causing the problem and where it was originating from. And it also allowed us to be able to perform ultrasound guided therapies where we could guide a catheter inside a vein and close it. And as a result of that revolution in ultrasound quality and the advances in the techniques, we were able to shift away from open surgery into using EndoVenous technology. So the revolution of laser therapy has been able to allow many more patients that otherwise weren't candidates for varicose vein treatments to suddenly be able to have those treatments performed very easily with no risk or very little risk. Around the early 2000s is when EndoVenous laser therapy became commonplace. Not only did I see a huge shift of where the treatments were done, but also the happiness or the satisfaction level of the patients that underwent the treatments. The ability for a patient to walk out of the office immediately after their treatment and be able to go do household chores or go play with their kids and not be sitting in a hospital with their leg elevated was a huge change in the practice of vein treatments and vascular therapies. So that EndoVenous revolution of going from surgery to accessing veins through ultrasound and IV access sites has really shifted where no longer do patients require operations to take care of their vein conditions that may lead to pain, swelling, unsightliness, etc., but instead can have the procedure performed in a physician's office in typically less than 30 minutes time and walk out of the office themselves with no limitations.